I am Paola Ghione. I'm an assistant attending at Memorial Sloan Kettering Cancer Center, where I work as a lymphoma doctor. This study was meant to figure out the risk of women carrying breast implants after breast cancer surgery, so mastectomy because of breast cancer, associated to the carriership of BRCA genes. We're talking about BRCA1 and 2, which are genes that are known to be related to the breast cancer and other types of cancers in carriers of these mutations. So the breast implant-associated anaplastic large cell lymphoma is a lymphoma that arises in the fluid around the breast implants. It is a lymphoma that's usually eradicated with removing the implants and doing a surgery to remove the capsules around the breast implants. And it usually starts 7 to 10 years after the implant placement. So at MSK, we have a very large cohort of women that were implanted at the time of the breast cancer surgery, and then were followed for many, many years after that. So we took advantage of this ongoing already well described study that we had, and we merged the data with our mutation analysis done on the genes of the germline mutations for these patients in order to see exactly what is the risk related to carrying these mutations with breast implants in place and the occurrence of BALCL, the breast implant-associated lymphoma. So we did that in a couple of ways. First, we analyzed the data on this whole cohort followed for many, many years. And then we also did a case control using as cases all the cases that we have seen at Memorial Sloan Kettering that had the same characteristics compared with the controls from this very long-term followed cohort. We found that the carriership of BRCA was associated to a much higher risk of developing breast implant-associated anaplastic large cell lymphoma in these women. From the patient standpoint, the implants that were associated with the development of this lymphoma have been recalled from the market in 2019. So right now, these type of implants are not put in place anymore. However, we think that there's approximately 500,000 to 1 million people still carrying these implants. For some of our patients, we called them and we talked about the risk of developing this lymphoma, and some of them had implants expiring because they have to be changed every 10 to 15 years. And so they just decided to remove them and put smooth surface implants in place instead, or simply removing them and doing another type of reconstruction, like with the muscle or other types entirely. So for the women who are carriers of BRCA mutations, probably other types of reconstructions that don't imply implants or this kind of textured surface devices that are associated with the development of the lymphoma may be preferred. And if you have one of these highly textured implants in place, it might make sense to think about in the future what to do when you have to change them. The surgery for breast implant-associated ALCL is a little bit more radical than just changing implants. It implies also doing a total capsulectomy, and so the removal of tissue is a little bit more than just a change. But these are the considerations that one may want to think about or do when thinking about breast reconstruction or putting implants in. Breast implant-associated lymphoma, it's usually very confined just to the fluid around the breast implants. Sometimes we can have a higher stage of disease. There's a staging that is very similar to solid tumors, not really to lymphoma. And so whenever there is lymphoma that cannot be removed by doing the capsulectomy, there's maybe a stage 3 where some lymph nodes are involved, then it makes sense to do a systemic treatment. So not just surgery to remove the implants and the capsules, but it might involve some other treatments. For example, because these lymphomas are almost always CD30 positive, and this is actually a very precise feature of the lymphoma, a drug such as brentuximab vedotin may be involved many times. If the lymphoma requires also chemotherapy, then there's a regimen there's a very specific regimen for this kind of lymphomas that's called brentuximab vedotin CHP, BV-CHP, which is very effective. And we had a couple of patients needing systemic treatment, and they've been doing very well. We've been working on looking at the risk. How does the risk change effectively when the women that are at risk, so that they have these implants, remove their implants or change them with smooth surface implants or do another type of reconstruction. And there are lots of women in this cohort that decided either to remove the implants or to change or to do some other reconstruction after we basically connected with them and explained the risk of carrying these implants. I think it's important to have a very honest conversation. The numbers are still very small. The lymphoma is not so prevalent, and it can be usually managed pretty easily. However, there are some deaths reported from this lymphoma as well, because sometimes it's not just confined to this area. And so in the near future, we want to look at this, at these patients who changed the implants, and if the incidence in our cohort that has been followed so well is changing due to these changes in the clinical practice that we're doing.